My name is Jennifer McKenna. I'm a dietitian that specializes in helping patients with ALS, and today I am here to talk to you about the feeding tube. What is a feeding tube? How is it used? And could this be something right for you? So first of all, what is a feeding tube? A feeding tube is a small, flexible, about a 1/4 inch thick tube that is used as an alternative for nutrition and hydration. This is what a feeding tube looks like. It's very flexible, pliable, and how it is placed. Typically, ALS patients receive what is called a PEG tube or a percutaneous endoscopic gastrostomy tube. So how this is placed, you are placed under a conscious sedation. So it would be similar to if you were getting a colonoscopy or an endoscopy. You wouldn't feel any pain, and what they would do is they would thread the endoscope down your esophagus, and on the end of the endoscope there is a light and a camera. So when the doctor can see where he's going, and when he knows he's in your stomach, he shines the light, and you can see it from the outside of your stomach. And they're going to put a small incision there. And then there's a guide wire that they have on the endoscope. And what they're going to do is they're actually going to thread the feeding tube down the guide wire, just like this, and they're going to pull it out, that small incision in your stomach. Once that's through, everything that was in your esophagus is removed, the endoscope is removed, the guide wire is removed, there's nothing in your mouth or your esophagus, and you're going to be left with the tube coming from your stomach to the outside. This bumper on the inside is what keeps it in place in your stomach, and then there's an outside bumper that is movable that keeps the feeding tube in its proper position. This procedure takes less than 30 minutes, and it can typically be done as a same-day procedure. Sometimes the doctor may feel that it is not safe to do in the same day, and so they might require a 1 or 2 night hospital stay, but the doctor would make that determination on an individual basis. The tract or the site of the feeding tube will heal over the next 2 weeks, and there's really minimal care of that site involved, just cleaning it with soap and water. All right, let's talk about when and why a person with ALS might consider getting a feeding tube. There are several criteria that we as a clinic team speak to a patient about when they think that that might be a good option for them. The first thing is if you're having more difficulty chewing and swallowing. So if you're having more issues getting nutrition in, meals are taking longer, you're becoming fatigued, or you're having more choking or coughing episodes, that would be one reason to consider possibly getting a feeding tube. The other thing we look at is unintentional weight loss. So despite trying to keep your weight up by, getting your calories in by mouth, you're still unable to do that. That could be a reason that a feeding tube might help you to get those additional calories that you need. And third is your breathing number. Patients with ALS often have compromised breathing, and it's better and safer to get the tube placed earlier rather than later if your breathing is compromised. A lot of times, or when they place the feeding tube, you have to lie flat, and you do have some anesthesia, so it's better if your breathing is able to support the procedure. Okay, so let's talk about how do you use a feeding tube and what goes through a feeding tube. Things that go through a feeding tube are anything that's liquid. So the nutrition that you're going to get is going to be a complete nutrition formula similar to an Ensure product or a Boost product. You can also put fluid or free water down the feeding tube, as well as medications. If you get liquid medications, they can easily go down the feeding tube, and some of your medications can be changed to a tablet form that can be crushed and flushed with water down the feeding tube. So how you would do this, the feeding tube has an open end where you would open the tip, and you would use a syringe just like this, and you would place it into the open end, and you would pour the liquid nutrition in the syringe, and it could just gravity in over the course of 5 to 10 minutes. When you're done, anytime you put anything in the feeding tube, you want to flush it with water before and after to avoid any clogging of the feeding tube. When you're done your feeding, you would remove the syringe and close up the tip to keep any liquid that might be reserved in the tube from coming out. And that's pretty much exactly how you would use the feeding tube. All right, now let's talk about some common misconceptions about feeding tubes. Sometimes I hear that patients think that once they get a feeding tube, they can no longer eat by mouth, and that's absolutely not true. The feeding tube is really there as an alternative method to get your nutrition and your hydration in. However, if you're still able and safe to eat, we encourage you to continue to do so, and then just to use the feeding tube as you need it. Some patients will actually get a feeding tube and really just use it for hydration because they're having difficulty getting enough hydration in by mouth first. And then, as their swallowing changes, they might end up using it more. We tell patients a lot of times it takes the burden off of you to have to struggle through a meal if you're having, more coughing or more choking, that you can eat when you want, how much you want. So if you, eat a couple bites or you have a small snack and you don't, feel like eating anymore, you can use that feeding tube to get the rest of your calories in. Another misconception is that the feeding tube will be a burden or take a lot of care for yourself or your family members. And I would say that the care of the feeding tube is very minimal. The site, you just clean it with soap and water. There's nothing special care as far as you need to do with that. And the feeding tube, once you use it, all you have to do is flush before and after anytime you put anything in it with water. And then when you're done, you just secure it underneath your clothes. And nobody would know that you had it unless you wanted them to know you had it. I think it would also alleviate some of the stress associated with meal times for you and your caregivers, if that is a stressful time and it's taking you a really long time. And also if you're having more issues, like I said, with choking, I think that this would be a really good option to give you that other method to get your hydration and your nutrition. A feeding tube is a personal decision for those patients with ALS and their families, and not everyone gets a feeding tube. If you have further questions, I would speak to your doctor, or if you belong to a clinic team, speak with a dietitian to see if a feeding tube could be right for you.